For 40 years, the United States government deliberately allowed hundreds of black men to suffer and die from a curable disease. They lied to their faces, calling it treatment for bad blood. They watched as wives got infected and children were born with devastating birth defects, all in the name of science. This is the story of the Tuskegee Syphilis Study, the most infamous medical experiment in American history, and how one man's conscience finally brought it crashing down. Picture rural Alabama in 1932. The Great Depression has crushed the economy, and African-American sharecroppers in Macon County are struggling to survive. Health care is a luxury most can't afford. Then government officials arrive with an offer that seems too good to be true. Free medical care, hot meals, transportation to appointments, and even burial insurance. All they had to do was participate in a study to treat their bad blood. But there was no treatment. There never was. The U.S. Public Health Service, working with the Tuskegee Institute, had launched what they called an observational study. They wanted to document the natural progression of untreated syphilis in African-American men. 600 men were recruited in total. 399 were infected with syphilis, though they were never told this. Another 201 served as uninfected controls for comparison. The men weren't told they had syphilis. They weren't told they were part of an experiment. They were simply told they were being treated for bad blood, a vague term that could mean anything from fatigue to indigestion. The researchers deliberately chose this misleading language because it sounded serious enough to keep the men coming back, but vague enough to avoid revealing the true nature of their condition. From the very beginning, this study violated every principle of medical ethics that existed at the time. The men gave no informed consent because they had no idea what they were consenting to. They believed they were receiving treatment when they were actually being observed like laboratory animals. The researchers weren't trying to help them. They were trying to study how a deadly disease would destroy their bodies over time. The deception ran deep. The men received what they thought were treatments, but these were actually just diagnostic procedures designed to monitor the disease's progression. They underwent painful spinal taps to check if the syphilis had spread to their nervous systems. These procedures, called lumbar punctures, were described to the men as special free treatment for their bad blood. In reality, they served no therapeutic purpose whatsoever. The researchers were simply documenting how the disease was eating away at their subjects' brains and spinal cords. To keep the men participating, the Public Health Service offered incentives that were irresistible to impoverished sharecroppers. Free medical exams, hot meals on appointment days, transportation to and from the clinic, and burial insurance worth $50. For men who had never seen a doctor in their lives, this seemed like a miracle. They had no reason to suspect they were being deceived by their own government. The study's true evil became clear in 1947. That year, penicillin was proven to be a safe and effective cure for syphilis. It became the standard treatment worldwide almost overnight. Public health campaigns across the American South began distributing penicillin to treat syphilis in the general population. But the men in the Tuskegee study received nothing. Think about that for a moment. The researchers now had a cure for the disease they were studying. They could have ended the suffering of all 399 infected men with a simple course of antibiotics. Instead, they actively prevented the men from receiving treatment. When some participants tried to enlist in World War II, the researchers intervened to make sure they would be rejected, because military service would have included mandatory syphilis treatment. The Public Health Service went to extraordinary lengths to keep their subjects from getting cured. They contacted local doctors and hospitals, asking them not to treat the men for syphilis. They told the men that their bad blood was improving and that they should continue with the study's special treatment program. All the while, they knew that every day without penicillin brought these men closer to disability and death. The human cost was staggering. Untreated syphilis is a progressive disease that attacks the cardiovascular system, the brain, and the nervous system. In its late stages, it causes blindness, paralysis, dementia, and death. The men in the study experienced all of these horrors while believing they were receiving the best medical care available. If you're interested in learning more about medical experiments and government cover-ups throughout history, make sure to subscribe because we dive deep into these dark chapters that shaped our modern world. By the time the study ended in 1972, 28 men had died directly from syphilis complications. Another 100 had died from related complications. But the tragedy didn't stop with the original participants. 40 of their wives had contracted syphilis from their husbands, not knowing that the government was allowing the disease to spread. 19 children were born with congenital syphilis, suffering from birth defects that could have been easily prevented with proper treatment. The wives and children were collateral damage in an experiment that treated human beings as disposable test subjects. The researchers knew that untreated syphilis was highly contagious, especially in its early stages. They knew that infected men would pass the disease to their sexual partners. They knew that infected women would pass it to their unborn children. They simply didn't care. For decades, this atrocity continued in plain sight. The researchers published papers about their findings in medical journals. They presented their data at conferences. The study was an open secret in the medical community, but nobody spoke out. The men were poor, black, and uneducated. Their suffering was invisible to the white medical establishment, but one man's conscience finally cracked the wall of silence. Peter Buxton was a social worker and epidemiologist working for the Public Health Service. In 1966, he began raising concerns about the study internally. He pointed out that the experiment was unethical and racist. He argued that the men should be told the truth about their condition and given proper treatment. His superiors dismissed his concerns. They told him the study was too important to stop. They claimed that treating the men now would interfere with the scientific data they had spent decades collecting. They argued that the men were too ignorant to understand the complex medical concepts involved. Buxton wasn't satisfied with these excuses. He continued to push for reform through official channels for 6 years. When it became clear that the Public Health Service had no intention of ending the study, he made a decision that would change medical history forever. He contacted the press. In 1972, Buxton leaked the story to John Heller, a reporter for the Associated Press. On July 25, 1972, Heller published an exposé that shocked the nation. The headline read, "Syphilis victims in U.S. study went untreated for 40 years. The article revealed the full scope of the deception and the human cost of the experiment. The public reaction was immediate and explosive. Americans were outraged that their government had conducted such a horrific experiment on its own citizens. The story dominated headlines for weeks. Civil rights leaders called it genocide. Medical ethicists condemned it as a violation of the most basic principles of human dignity. Senator Ted Kennedy launched Senate hearings to investigate the study. The hearings revealed even more disturbing details about how the experiment had been conducted and covered up. Under intense public pressure, the Department of Health, Education, and Welfare finally terminated the study in October 1972, just 3 months after the story broke. But the damage was done. Of the original 399 men with syphilis, only 74 were still alive when the study ended. The survivors and the families of the victims filed a class action lawsuit against the federal government. In 1974, they reached a settlement worth $10 million. The government also agreed to provide lifetime medical benefits to the survivors, their wives, and their children. The legal settlement was just the beginning of a long process of accountability. The Tuskegee study had exposed fundamental flaws in how medical research was conducted in America. It showed that researchers couldn't be trusted to police themselves when it came to protecting human subjects. The scandal led to sweeping reforms in medical research ethics. In 1979, the Belmont Report established 3 core principles for human subjects research: respect for persons, beneficence, and justice. These principles became the foundation for modern research ethics. The report also mandated the creation of institutional review boards to oversee research involving human subjects. These reforms were necessary but insufficient. The Tuskegee study had done more than violate research ethics. It had shattered trust between the medical establishment and the African American community. This legacy of mistrust continues to affect public health today. Surveys consistently show that African Americans are less likely to trust medical professionals and participate in medical research. They're more likely to believe that doctors might use them as guinea pigs or withhold treatment based on their race. These attitudes aren't irrational paranoia. They're the logical response to a documented history of medical abuse. The impact of this mistrust extends far beyond research participation. African Americans are less likely to get vaccinated, less likely to seek preventive care, and less likely to follow medical advice. They're more susceptible to health misinformation and conspiracy theories. The Tuskegee study didn't just harm the men who participated in it. It created a legacy of fear that continues to cost lives decades later. In 1997, President Bill Clinton offered a formal apology for the Tuskegee study at a White House ceremony. He called it shameful and clearly racist. He acknowledged that the government had betrayed the trust of the American people and promised that such experiments would never happen again. But Clinton's apology, while symbolically important, couldn't undo the damage. The men who suffered and died in the study were gone. Their families had been torn apart. An entire community's faith in medical care had been destroyed. The apology was a necessary first step, but healing would take much longer. The last known survivor of the Tuskegee study was Ernest Hendon, who had been part of the control group. He died in 2004 at the age of 96, 32 years after the study ended. His death marked the end of a dark chapter in American medical history, but not the end of its consequences. The Tuskegee Syphilis Study stands as a reminder of what happens when scientific ambition overrides human dignity. But it wasn't the only time the American government experimented on its own citizens without their knowledge or consent. In the 1950s, the CIA dosed unsuspecting subjects with LSD in a program called MK Ultra. In the 1960s, prisoners were infected with malaria and exposed to dangerous chemicals. The question isn't whether these experiments violated ethics. The question is, what experiments are happening right now that we don't know about yet?